Are you also following the Lindsay Clancy case? Is it possible to make a plan while having a psychotic episode? Can over-medicating or under-medicating a mother cause her to murder her 3 kids? Let's talk about the trial of Lindsay Clancy, postpartum psychosis, and her cocktail of medications. What's really going on? Today we're going to talk about a case that's currently on trial. It's the case of Lindsay Clancy. In case you haven't been following the trial, she is a Massachusetts mother of 3 who ended up back in 2023 murdering all 3 of her kids using an exercise band and then jumping off a balcony. She is now paralyzed from the waist down, and she's on trial. We're going into the 2nd week of trial. Now, she is saying that the time she committed the crime, she was suffering from postpartum psychosis. Now, the prosecutor is saying that she wasn't suffering from postpartum and that this was deliberate murder because she planned the whole thing. Before we go any further, I'm Dr. Yalda Safai, and this is Freud and Felons, where we dissect the anatomy of devious human behavior. I've done a full episode on postpartum psychosis in the past. If you haven't watched it, please do. But very quickly, postpartum psychosis is a condition that is very rare. It affects about 1 in 1,000 mothers, and it's a collection of symptoms, including hallucinations, delusions, paranoia, rapid mood shifts that happens after someone gives birth. And this is a result of hormonal changes that occur after birth, severe sleep deprivation, immunological changes that happens in the mother after birth. So the defense here, Lindsay's lawyer, is saying at the time she committed the crime, she was struggling with postpartum psychosis and that she really didn't understand what she was doing. The prosecutor is saying because she was able to plan this, then it must mean that she wasn't suffering from a mental illness, and they're trying to trial her for murder. Lindsay, at the beginning of the trial, pled not guilty by reason of insanity. I did a whole episode on that as well. Please check it out if you haven't done so. In order for somebody to prove insanity, they have to prove that at the time they committed the crime, they didn't know what they were doing, and they didn't know what they were doing was wrong, and that has to be as a result of mental illness, which, by the way, is very, very hard to prove. The insanity defense is raised in about less than 1% of cases, and only out of that 1%, about 25% of them are successful. So it's a very hard thing to prove, and it's very rare. So Lindsay is not saying she didn't do this. She's just saying that at the time she did this, she didn't know what she was doing. So what is postpartum psychosis? I also did a full episode on that. Please check it out. Postpartum psychosis is a very rare condition. It affects about 1 in 1,000 mothers. For somebody who has some sort of genetic vulnerability to a mood disorder, when that person goes through the rapid changes that happen post-birth, I'm talking about hormonal changes, immune system changes, and not to mention sleep deprivation. When that person goes through that, it can sometimes lead to things such as postpartum depression or postpartum psychosis. Postpartum depression is a lot more common. It's major depressive disorder after someone has given birth. But postpartum psychosis, the more serious version of this, is when a person starts developing hallucinations, delusions, paranoia that happen after they give birth. Now, something interesting about the delusions associated with postpartum psychosis. First of all, delusions are fixed false beliefs that are not based on reality. When it comes to the delusions in postpartum psychosis, a lot of times the mother genuinely believes that the only way to save their kid from some unknown thing that they imagine is by harming them. So we call this altruistic delusions. It's really not because the mother is evil, it's not out of rage. Sometimes it's out of pure love. They feel like the only way to save the kid is by harming them. Now let's go back to Lindsay Clancy. There's a few things that have come up during the trial, and it seems to be a topic of conversation all across social media and on the internet. First and foremost is the topic of Lindsay's medications. She went through a series of medication changes. I mean, there's a list of about 15 different medications that Lindsay tried leading up to what she did. And a lot of people are arguing that was she over-medicated, or did the medications she was on cause her to do what she did? As a psychiatrist, I'm here to shed a little bit of light on the whole medication argument here. First and foremost, medications don't have the potential to cause someone to develop postpartum psychosis. Postpartum psychosis happens because of these hormonal changes that rapidly happen after someone gives birth. So no medication, or at least no medication that Lindsay was on, has the capability to cause someone to become psychotic, to start having paranoia, to start having hallucinations or delusions. And secondly, no medication can cause someone to become homicidal, so to speak. So all her medication regimen proves is that Lindsay had a prior existing mental health condition, which is really, really important for this trial. The medications she was on were mostly mood stabilizers or anti-anxiety medications. Now, Lindsay's main psychiatrist, Dr. Jennifer Tuff, testified on trial that she was struggling with a lot of mood-related problems, anxiety, depression, trouble sleeping, and her medication regimen reflects that. Now, remember how I explained that postpartum psychosis usually happens in somebody who has a prior mood-related disorder, something like bipolar disorder or something like family history of bipolar disorder or schizophrenia. So all this medication regimen proves is that there was a prior existing mental health condition. It does not in any shape or form mean that any of these medications caused her to do what she did. The third thing I want to address is a lot of people are saying that because she was given so many different medications, her medications changed multiple times, that was the reason that she was destabilized mentally, so to speak. Here's what I want to clear up about this as a psychiatrist who treats mental health conditions, that treats psychosis and mood-related problems. Mental health treatment is not like any other treatment in medicine. There is no one fix for everybody. It's not like treating an infection. When someone develops like an ear infection, for example, it's the same antibiotic you give to everybody to clear up the ear infection. But it's not like that when it comes to psychiatric conditions. Unfortunately, a lot of it is trial and error with medications to see what medication works best for the patient. There is no one size fits all. So aside from trying different medications to figure out which one works the best, there is no other way to do this. There is no blood test you can get from the patient to see what medication they will respond to. None of that. It's all trial and error. I wish there was a better way to do this. If there were, it would definitely make my job easier, but there isn't. So it's a lot of trial and error, and it seems like that's exactly what Lindsay went through. She went through a series of medication changes because each one that she was put on was either not working for her or had severe side effects. That's why she had to keep changing her medications. It doesn't mean that she was on this list of medications all at once. She didn't take all of these all at once. She was trying multiple different medications to see what was right for her. It is an extremely stressful process for the patient, and sometimes they get worse before they get better, but there really is no other way to do this. So I want to clear that up. So here's the thing. She could have not been on the right medication for her. As Dr. Jennifer Tuff testified, and two other psychiatrists also testified during the trial, that before she did what she did and afterwards, none of them saw signs of psychosis in her. If they had, she would have probably been on a different type of medication regimen that specifically treats psychosis. But because none of those psychiatrists saw anything in her to indicate psychotic-like symptoms, she was probably not given a medication regimen for psychosis. Now, again, this is not negligence or anything on the side of the doctors because mental state of a patient can change day by day. One day she cannot have any psychotic symptoms and the next day she can develop psychotic symptoms. So it seems like during the time that she was being treated before she committed the act, no psychiatrist picked up on the fact that she was struggling with psychotic symptoms, or she probably wasn't struggling with psychotic symptoms and it developed afterwards. We don't know. And I personally haven't evaluated Lindsay to tell you which is true and what is not. But purely based on the testimonials of the doctors, what they were seeing was anxiety, depression, and insomnia, and she was being treated for that. Now, if she did present with psychotic symptoms, if she did have overt hallucinations or delusions when she was seen by those doctors, she would probably have been given something like an antipsychotic to treat those symptoms and not just a antidepressant. That's not saying that giving an antidepressant is wrong. No, if someone is struggling with depression, you give them an antidepressant. If they're struggling with insomnia, you can give them a medication for sleep. If they're struggling with anxiety, you give them an anxiety medications. It seems like to me the doctors did everything they were supposed to do. But sometimes a patient just doesn't respond to medications, or they just hadn't found the right cocktail for Lindsay in that case. Another thing I have to point out is that postpartum psychosis is rare. One of the doctors that was testifying said that she has never even seen a case of postpartum psychosis before. So it's very hard to be able to accurately pick up on something that you have never witnessed in your career and you've never seen before. So we can't really fault the doctors for not being too familiar with postpartum psychosis and the subtle signs of it. Every doctor testified that they didn't see delusions in her. They didn't see hallucinations in her. They didn't see anything concerning in her. So unless a patient tells you directly that they're having thoughts of hurting the baby, it becomes very, very difficult to be able to catch that. And this is from my personal experience. I have seen a lot of mothers hesitant to talk about the intrusive thoughts that they might be having about their baby, or they might be hesitant to say they're having suicidal thoughts or homicidal thoughts because they're fearful of Child Protective Services or somebody taking their baby away. And this is something that I have personally seen in my own practice. This is a legit valid concern, but a lot of times, unless you verbalize to your doctor that you're having thoughts of harming the baby, the doctor would never know. The next key question of this trial is whether someone is able to make a plan when they're in the midst of a psychotic episode. I think that's $1 million question because the prosecutor is saying that is not possible. Lindsay had a plan. She executed the plan. She carried out the plan. Therefore, she must not be struggling with a mental illness. The defense is saying this is exactly what happened. Lindsay was in the midst of a psychotic episode, but she was still able to plan. And the plan they're arguing here is basically just sending her husband to the grocery store so she can carry out what she wanted to do. So it's not a very sophisticated, elaborate plan. Now, I don't know Lindsay. I don't know if she actually had postpartum psychosis. I don't know what went on in her head at the time she did what she did. I'm going to say purely from my own experience and my own perspective treating patients with psychosis, it is possible to be in the midst of a psychotic episode and still carry on with your day as normal. And it's very possible for you to seem normal to everybody else around you. But any plan or any action done in the midst of a psychotic episode is still a psychotic plan, so to speak. It's a plan that's based on delusions. It's a plan that's not based on reality. So I want you to remember that when we're talking about this whole plan element, because it is very much possible to be doing things that's still in your head seem like the right thing to do, but really they're not based on reality at all. To conclude, it's possible to make a simple plan when someone is in the midst of a psychotic episode, but that doesn't negate the fact that they were in the midst of a psychotic episode and they were mentally ill when they came up with that plan. The third element I want to discuss is how long the postpartum period actually is, because this did come up in trial. Both the prosecutor and the defense asked one of the treating doctors what they thought the postpartum period was. And this came up because the murder happened 6 months or more after Lindsay gave birth to her last child. So it's interesting because the doctor that testified said it depends on who you ask. Different organizations have different definitions of what the postpartum period is. Some say it's 3 months after giving birth, others say it's 4 months, some say it's even up to 6 months, and some say it's up to 1 year. So what is the right answer? It's interesting because we don't actually know what the right answer is. But from my experience, a woman can continue to go through changes in mood, hormonal changes, sleep-related problems, up to a year and even more after giving birth. So is there a definitive cutoff for when the postpartum period ends? As of right now, no. And I think medical communities need to come up with a better definition and a better timeline for what the postpartum period is. Because if they do have that, if they have a concrete, if they have a defined period where a woman is at highest risk of depression, anxiety, postpartum, they can be monitored accurately for up to that period after giving birth. And this distinction matters in this case because If the prosecutor can prove that the postpartum period was over when Lindsay committed the crime that she did, then postpartum psychosis will no longer apply. At that point, it will be a murder trial. Now, what are the potential outcomes of Lindsay Clancy's trial? Whether she is found guilty of murder or she is found not guilty by reason of insanity, the outcome is pretty much the same. In neither one of these scenarios, Lindsay gets to walk free. There is no win here for Lindsay. If she is found guilty of murder, she'll likely go to prison for the rest of her life. If she is found not guilty by reason of insanity, however, she will be transferred to a high-security mental health facility, likely for a very, very long time. And as somebody who's worked in these facilities, I gotta tell you, these are not therapeutic retreats. They're basically just prison for those who are deemed criminally insane. They're a place for these people to be able to get the psychiatric care that they need that they might not get in prison, but it is still a locked facility. Andrea Yates, who in 2001 drowned all 5 of her kids in a bathtub, is still, to this day, this is 25 years later, is still in one of these psychiatric facilities. So neither one of these scenarios is a win for Lindsay. Lindsay will never likely walk free again. It's important not to see the insanity plea as a way out. It's just a way for somebody who is truly struggling with mental illness to be able to get the care that they need going forward. Thank you for listening. I'm Dr. Yalda Safai, and this is Freud and Felons. Please like, subscribe, and comment to appease the algorithm.